Good morning, folks. This is Shippy the Explorer. You're looking at my beautiful wife, and I'm looking at the beautiful wife too, and saying good morning to you. And we're coming from you, broadcasting from College Park in the household. Um, how are you? Welcome back to this medium, and trust that you're going to enjoy this topic or going to be an enlightened topic. It's a tough topic, a difficult topic to talk about, but we have been touching on it this morning, and we are talking about the restriction of after surgery. So as you have a partner, you look at the beautiful partner and life, and you realize and you feel the restriction in the legs. Well, legs, you you're very conflicting situation, that your mind is saying one thing and the doctor is saying one thing and your body is saying one thing. So it's a serious topic that we're addressing today. Saying for our friends, you said in the Jamaican saying, you can't even smell. Can't even get a smell off of the pudding. Not even a smell. You're restricted. So, a restriction from the doctor, restriction from the surgeon, restriction from the nurses, restriction. And in your mind, you're saying that you should go ahead. But this is one of the things that really, I don't think I'm too starved for affection and all that. But this is one of the things that Shippy the Explorer wants to explore this morning with you in saying a lot of people don't talk about it. They're saying they're afraid to address the topic, of when you feel one thing emotionally in your body and then you're restricted. Yes, the surgery comes with restrictions, and the simplest ones is restriction of food and certain medication. And before you go into surgery, they said stay away from the your aspirins, stay away from your natural medication like ginger, stay away from even your painkillers, stay away from excess iron, stay away from the fact that you don't want to take too much not anticoagulant, but medication that will cause the blood to be too thin, like aspirin, anything to do with that. Well, we're going out this morning for a walk. And that's the thing. And then just before the day of the operation, you're not supposed to have foods of certain thing. You need to stop to eat and drink before 12 o'clock at night, so that when you go for the surgery, you don't have certain ailments. I guess if you eat just before, after 12, and you go for surgery, the stress and strain on the body will cause you to be excreting liquids of different sorts and maybe feces and all sorts of things. So you don't want to have that type of thing. So there's a restriction on all of that. And the restriction of staying up, you don't want to stay up all night and don't get rest, and so you end up in in being tired. And then you have to have certain foods before you go into surgery. In my case, with the hip surgery, they encouraged me to have Ensure and Life or something like that, extra nutrient to boost up the body, protein to make the body strong, so that when the operation comes and they have to cut into muscles and all sorts of things and remove bone and all sorts of things, then the recovery process is better. And so that was the case. So restriction. So we're talking about restriction this morning. Shippy the Explorer is exploring all of that. And then even at home, you think because the spouse is so worried about you, they place restriction you. If it's a woman or a man, they say stay away from doing certain sexual activities. Stay away from those things because they think you're gonna kick the bucket and they don't want to lose you. So we are talking about restrictive. Remind you that you're watching Shippy the Explorer, and Shippy the Explorer is a big argument today, not argument, discussion about restriction before, during, and after surgery. And so, in this beautiful sunshine in College Park, we continue the story. So we were laughing this morning because we're kicking up we were saying if we put this tape out, certain members of our subscribers and friends and something will get a laughter and they will be kicking up, saying Mr. Morrison, Shippy the Explorer is really into something this morning. And I know who gonna be laughing at me and saying, what? Didn't you say that? Oh, yes. We are addressing the topic this morning because I'm telling you, mind over matter, mind over physical, over physical ability is a Dickens of thing. We say Dickens because we don't want to curse on the station. You are in the state of saying losing the prostate, because of prostate cancer, and you have had the surgery, and so in your mind you're thinking that you should be comforted with sex and emotion and reaction, but there is a restriction there that a lot of people don't want to admit. You're restricted because you're not physically capable of being a person of your 20s and 30s and 40s anymore. And so you have to face that. But your mind is playing on top of you. Your mind is playing havoc with you. And in my case, my spouse would say, it's all in your mind. It's all in your mind. Does it? Is it? And I'm telling you, some folks who have had this surgery will tell you that, oh, there's nothing wrong. I'm okay now. I'm okay there. When it comes to that, I'm okay. Because they want to tell you that. They don't want to be embarrassed. There's something serious and wrong about especially male who cannot accept the fact that they are not capable of doing physical and sexual activities as they used to, because that area comes with shame. The culture all across this world, that comes with shame and embarrassment. Whether you're in Americas or the Caribbean and Africa, It's they talk about the manwood, and if you're a manwood, it has to be strong. You have to be vital and vigor and strong. And if you're not, you don't want nobody to know because you don't want to be embarrassed. And so the restriction of of wanting and can't is there. So we have to be honest with ourselves in certain in my case. I am not scared to tell you guys or the world that we have to be honest with ourselves that whenever you have especially prostate operation, it comes with a diminishing of or decrease in the ability to perform. And so, well, you have to use your mind and imagination to be active in other ways and feel okay, so you can satisfy certain urge. And so it's that's what it is. And then the other thing is the restriction in getting whole naturally. You don't want to tell anybody that, oh, that's I'm having problems in the bedroom, and not even having problems, but you're saying you pretend like you're still the young, vibrant person you are. And so we are deceiving ourselves, and we are deceiving our spouses, and we are not coming to reality, to a realization that, oh, wait, here's a problem. Let's make an adjustment in what we do. And some people will just, even if you're not having spouse, but you're having friends, you maybe go around and talk big talk, and so in the bars and the clubs, and so it's only talk. But we are talking about seriously about these restrictions on us. So here we are. So prostate does it, and hip surgery does it, and heart surgery does it. Because when you have an heart surgery, your spouse is gonna be mindful and don't want to even come near you, because you're saying you don't want the poor man to die. Here's the old saying that you have these old men in Jamaica, and they think they're sexually driven in their mind, and so when they have these ailments, they go and test themselves, and some of them don't come out of that intercourse relationship because they're a dead man, a dead as nail on top of a live object. And so it's that is the last time they'll ever boast, because they're dead and gone, and they're not able to come back and say what happened, because they were trying to prove something that they are not. Right. So the other thing that affects the whole of the body is mental sickness. And mental sickness cause, I am not the expert, but I would imagine that it also mental sickness affects your sexual ability. And so that we have to be mindful of that. And that's a ticklish one, because if you're mental, you're not going to be even discuss this with friends, and maybe not even with doctors. You're not going to do that. And so that's what it is. So here we are now. So in this case, we are talking about the restriction that the hip surgery has done to Shippy the Explorer. And so, for one thing, they put a restriction of 6 to 8 weeks for you not to bend backwards, not to pass the 90-degree angle that especially, I don't know if I can demonstrate, they don't want you to bend over like this more than 90 degree. They don't want you to bend down and pick up things, because I suspect that the blood will rush into the brain and cause it to fall over, or in the other case, maybe lack of oxygen to the brain, and then you go into a coma. And then if you restrict your body and do certain things, I suspect that you'll probably have blood clots. So the restriction is not to, so some of the restriction, come down here, this spouse is coming to help me with the tape. Some of this restriction was not to bend down and pick up anything off the floor, not to put on your socks, not to stretch the foot backwards. Here we are, we didn't want it to stretch back, but you saw the tape that 2 days ago that came back with a kick, and that was excruciating. That pain was, I'm going to repeat it, that pain was more excruciating than when I did the operation. And the other restriction that they put on you is that you have to be on certain diets. You cannot, another thing, you could even bathe. Can't even bathe for 3 days. And you want to take a good shower, nice, hot, warm shower, and here you are, because what we find out is that the water, if you use certain soap, if the soap has antibacterial elements into it, it will go on the wound and kill the natural bacteria that helps to heal the wound. And so that's where we're having problems. So if you kill those bacteria, then you're not gonna have good healing. So you have to you're restricted to just run the water over your body after 3 days and let only water touch the wound, and then the surgical area, surgical site, and then you just dry it off with a clean towel. Yeah.
But after those 3 days, also that you're gonna do your shower, you still have to cover the area with plastic, something that penetrate the water through the dressing. So we still have to cover up.
Right.
And that dressing actually wasn't removed until the follow-up visit.
Which is a week or 2 weeks after?
A week after.
2 weeks.
And lucky thing, the wound wasn't infected, so that's a good thing.
Right.
So that was good.
So look at my beautiful wife Carol, and he's going to say, okay, what do you think? Yes, we're talking about Carol this morning. We're calling Carol this, putting Carol this. That's a number. That's the one will get the best joke. No, a lot of you girls will get a lot of the jokes of this. What do you think Shippy the Explorer should be thinking? Restriction. Can I make it? Oh yeah, we have to make it, because it says mind over matter. Hey, I don't know about that. So they say, okay, can't even go near. Well, yeah, can't even go near the person. That's the restriction. So we'll continue this tape. We're talking about restriction as we go along, and we're going for a walk, and we'll continue this conversation. So let's go take you with us on the drive. And that's another restriction. Make it stay for now. So we're gonna go into. You've seen us go into the van. You have seen me go to church, and we're going into the car and go for a walk. And I'm gonna practice this leg to lift.
Sorry.
Let's lift the leg, drag it in, and bring in the good one. And we're ready to go. Yeah, so we continue the tape. I'm talking about restriction before, during, and after surgery. So there's a restriction about walking, and well, it's not even a restriction. It was a stipulation that I had to get up every hour. Poor wife had to wake me up even when I'm not sleeping in the pain and walk. We had to stretch our legs. I had to. But surprisingly, with this operation, I may have mentioned it before, but they did it in 90 minutes and then came out in the recovery room. And I'm talking soft now because it's a mystery. And then they didn't pull all the IVs out of me, but they put me in a situation and say, get up and walk. You have to walk. Shippy the Explorer, it's time to walk. And within 2 hours, an hour and a half after the operation, I was walking in the recovery room, walking up and down. And then in another hour or so, I was told, you have to get up and go home. So I had to walk to the exit, and then I got into the car and went home. So that was a stipulation that they had put on me. And so what happens now is that I have to walk every hour, 24 hours, day and night. Every hour I had to get up and walk. And really, I think it really helped. So that was a stipulation. This is a little bit different from being restricted. So what is any other type of restriction that you, as a spouse, you are fearful of? You may not want to admit it, but I think the spouse is afraid of the person who got the operation keeling over and dying. You think that was a fear you had? Ask me a question. What did you feel when you have the operation? When I feel the operation?
Okay. The fear was, seeing that I know that you have problem with anesthesia. I was afraid that you're probably gonna have difficulty because of previous experience coming out of it. So that was my fear. But lucky thing they didn't give you a general anesthesia, but that was my fear prior to the surgery. But then I pray and I ask God to help us through the surgery. And I just wasn't scared anymore. I was not scared anymore. So that was it. I just have a good feeling that it's gonna go well. And surprisingly, and I'm very impressed that a few days after the first week, I didn't expect you to be able to, move around as you were moving around. So that was a good thing. That was a good thing. And you're still doing great, considering, your age and the surgery. So that's good.
So the operation that caused it to be so fearful was the last when I did the wrist operation, when they couldn't wake me up or something like that.
Yeah, I think it was the wrist, because that one I had experience of the nurse coming to tell me that they can't wake you. So I said, please go wake him up. So that was my greatest fear. Not that the surgery wouldn't go good, but my fear, because first time before, years ago, when they used to do surgery without intubation, a lot of people used to die during that time because they weren't intubated.
So
But then they
intubation
found
is
out putting the tube down your
to
throat
give you oxygen.
to supply oxygen.
Mhm.
Yeah. So then they found that out. It wasn't the surgery killing people, but the lack of oxygen that they weren't getting. So they did improve on that. And I kind of trust the doctor, because he told us that he has done several of these surgeries before. He even did 2 or 3 the day before when we
A
went
week
to
before.
plan.
No, 2 weeks before.
No, he
This-
said 2. Like
Yeah, when we
yesterday, he
saw him
just did two of them.
When we saw him first, he said he just did 2
2, yeah.
the day before.
So
Uh-huh.
that kind of made me feel good about the surgery.
Well, we're talking about restriction. We're talking about restriction, babe. What kind of restriction you're placing as a spouse? You're trying to protect the
Yeah, because the doctor says, maybe you're afraid to say that. The doctor said no sex for 6 weeks.
No, I
And
I said it in
Oh,
the,
you say it already.
Well, not like the verbatim, but I mean, but
Okay.
I mean,
So that was a restriction, and it is a restriction.
because your spouse is hoping that, and not hoping, but your spouse is thinking, oh, if you do certain things, you're gonna die.
Not die, but it will affect you. It will
What
set
will happen?
your back. I mean,
What do you think will happen?
you could, the hip could be out of socket just by, moving and doing movements that you're restricted against.
But do you, as a nurse, do you think also blood clots or something like that can occur?
Yeah, anything after surgery, any complication can occur, and of course, blood clot is the biggest one of them. So you have to be careful.
Heart attack. But heart attack comes from a blood clot. Heart attack comes from a blood clot, folks. It's the heart muscle
Deprived of oxygen
deprived of oxygen because
due to the clot.
yes. So
Yeah.
that's so surgery. As a nurse, I think she's more aware. I think you're more aware that certain things can happen than the ordinary person.
Mm-hmm.
Yeah. But I'm telling you that there is something truth about that, because I'm telling you about the episode of being nauseated and then had that forceful movement in the surgery area. It was really bad.
I better move from here because they're gonna cut that grass,
Okay.
and they're gonna mess up the car.
Go behind. No, that's too low too. Let's go up here, so right here.
Are your door open? I'm gonna go park behind this lady over here. is.
The limbs are too low for the car. And on my vehicle, you know, your door. So we had to cut the argument short.
This
We have
happened
to.
before. When I come, I see them cutting, and I had to move the car because they're cutting
Oh,
over
yeah,
on that
right.
side.
What if he's gonna cut over here too?
They're not cut over here.
Oh.
Maybe some other people cut over here, but
So were you in the room when they gave me the spinal tap?
yeah, I was. The guy was there.
Did you see when he go in my back and
He
feel
was,
for it?
yes, for the
And did you see him inject me?
area. Yeah, he had the
Where him inject me?
syringe in your back.
I never.
Yeah, he was in the room. You weren't sleeping then.
No, but we
And
don't
then-
feel that the injection.
Well, he did good. He did a good job.
We don't feel. I didn't feel that injection.
He did.
I only feel. The only injection I feel, no injection, but the sensation I feel was when he was using the needles to
To see
Prick.
if you
prick all over the body.
Yeah, he
And I
did.
remember him prick down the bottom here and see if you feel that. And I said no. And then he prick above the waist, and then I felt that, and I said yeah. And then after that, I didn't feel it. I didn't know
Then
anything
they
else.
put medication also in the IV.
To put me to sleep.
Uh-huh.
Yeah, to put me to
Helped
sleep.
you to relax.
Yeah.
And so you could
And they put me to sleep finally. But why they did that, folks, is the restriction that the restriction that I have. Is it restriction? I didn't want to take the, as Shirley's saying, didn't want to take the general anesthesia because that was a problem. Because we not being able to wake up the last surgery. So we're continuing up talking about, this is Shippy the Explorer. We're talking about restrictions of various things in life. And stay tuned. We're going to go into the park, and maybe we get more inspired by and tell you our ordeal. So I've been somebody told us at church, so you never leave your home, even when you're feeling good, to leave your home without the stick.
The cane,
Did I wrong thing? I'm gonna go.
you come upon your bad leg.
Yeah. All right, put on this. So we're going for a walk in the park, and I'm carrying all the goodies. There we go. I don't want to rely on this stick too much. I think it's just for keeping me steady, folks. Yeah. So we're continuing the big argument, big discussion this morning, serious discussion about being restricted on certain things we do. Yeah. So one of the ones which is helping me to relax and think and even feel like I'm on a vacation is the fact that I'm not allowed to drive. And although it puts a strain on members of the family, it helps me to stay out of all the activities and get a break from things, from all sort of activities. It's taking life seriously.
Go ahead.
Wait, let's finish the tape, and because I need your opinion of restriction.
Don't we already talk about the restriction?
All right, you're talking about that. You don't want to discuss anymore. I think you feel
We already
Ricky
discussed
speech.
all the restrictions.
all right. So that's the topic this morning. One of the topic about being restricted. And so it's as I said, you're being conflicted with your mind and your body, and you have to follow doctor's orders or even the orders from the old soul. So that's where it is, folks. So don't feel bad, don't make comments, and if you want it,
subscribe and share.
but do make comments if you think you have something different in your mind. So you're gonna say how a man is supposed to go ahead, telling her to go ahead. How is a man supposed to live without certain things in life? But you just have to. Taking I'm telling you. So, but you're gonna say, man can't live without bread. So yes, you can live without bread and certain things, certain times when it's being restricted. But we have to be back to the same thing. We just have to be honest with each other and saying that that's what it's about. You may not want to talk about it, but I know a lot of us are feeling the pressure of being restricted at home in certain things. So be a man and at least discuss it with your partner so that that aspect of your life will be lighter, make life lighter, less complicated and less stressful. So this is Shippy the Explorer. I don't want to say much more, and probably I don't have much more to say, so I'll just leave it at that and say that's the tape about being restricted at home and abroad when you have had physical disturbance or even mental disturbance. So take care, and look forward to see you another time on another video when we have hot topics at Shippy the Explorer. As we walk this park, we say bye for now. Take care. Have a wonderful day. See you later.